Good morning, everyone. Wendy here from Broad Garden. Welcome to the next episode of Breast Talk. We're very, very excited, super honored. We have a wonderful, wonderful plastic surgeon here today, and we'll talk all about him in a second here. First of all, let's say happy Monday. Everyone got through the weekend. Hope you had a great time. Nice and beautiful outside, right? Sunny day again, no rain, fantastic. See if these Santa Ana winds start blowing in. It's supposed to, crazy. But without further delay, I would love to introduce one of my good friends, plastic surgeon that I've worked with for years. Fantastic, amazing. Right?
Oh my goodness. Thank you.
Dr. Garrett Wirth.
Well, thank you so much for having me here today. This is such an honor to join you and your teams. I mean, you're just these programs are so beneficial for so many people, especially women, in terms of growing information and opportunities for people. So the invitation, I couldn't pass it up for sure. And you've put up with me for so many years in the operating room, and the relationship has grown on that side of things as well. So while these formats are not my strength, you've asked me to talk about breast augmentations, breast surgery, even potentially some reconstruction today, and I'm just so passionate about sharing that information. So the invitation was amazing, and thank you so much for that.
Oh, I'm so happy to have you here. It's great. It's truly is an honor. Now, but for those that don't know you, I mean, you've been around for quite a while, but why don't you tell us just a little bit about your background? Where did you go to school? Kind of.
I was born a very small human being back in New York, and basically spent the majority of my life back in New York. So I went away in undergrad into Pennsylvania, but then ended up following a path doing research actually. And so I went back to upstate New York and went to Albany Medical College, where I got a master's degree in physiology and cell biology. And the only reason it was a master's degree is I moved out of path from PhD because I decided at that point I wanted to go to medical school, and stayed right at the same college, and then actually matched in general surgery at Albany Medical Center. So I did my general surgery training there, and finally moved out to California in 2002 actually, and did my fellowship in plastic and reconstructive surgery at the University of California Irvine Medical Center. And so within that, there's the Aesthetic and Plastic Surgery Institute. And so that was a additional 3 years of training on top of the general surgery training. So it was a long path, and I think my children told me that I graduated in the 29th grade. So I had completed all that, and I was setting one path forward. Another opportunity came up. I was really honored to be asked to join the faculty at UC Irvine. And so I did, and I stayed there, but rapidly became a full professor of plastic surgery. And I did that all the way through 2017. At which point I moved to volunteer faculty because I opened my private practice in the potentially underserved population of Newport Beach, California. But while the practice is centered there, the reach has been absolutely amazing throughout Southern California, throughout the United States, and people have even flown in from other countries to get work done with me. So I've been very blessed in my life, and hopefully I didn't go too long, but that's sort of my course in terms of getting to where I am now. And my practice is really just such an amazing opportunity for me to give back and serve, and I love what I do.
And it shows.
Oh,
it shows. For those of you maybe who haven't met me yet, I've also worked in the operating room. Well, I'm 18 years now. But many of those years have been with Dr. Wirth, and I wouldn't have invited him here if he wasn't amazing. But talking about your schooling, so you were saying how you're doing the general surgery and then 3 more years for the plastic. So something that I hear, and I think sometimes people get confused, what's kind of the difference between a board certified plastic surgeon and let's say a cosmetic surgeon or
I greatly appreciate the question, and I'm going to expand on it a little bit as well. So while most programs, training programs now match directly out of medical school into what's called an integrated program, and for the most part, that's 3 years. That they do a fair number of general surgery rotations, but also ear, nose, and throat, dermatology, things like that. And then they do 3 years of plastic surgery training, but they're done in 6 years. Almost all programs now are that format. There's the more traditional training program, like myself, you would come out of a couple of different specialties. You could come out of orthopedics, urology, neurosurgery, or traditionally general surgery. And then you would go to a fellowship and do either 2 or 3 more years of plastic surgery training. So there's a big difference, almost a generation worth of difference now in terms of that type of training. Beyond that, there's a confusion in terms of sometimes when people are going to a plastic surgeon, because there's a pathway through otolaryngology, or some people will say ear, nose, and throat surgery, where they can do a 1-year fellowship in facial plastic surgery. And so there's this board of facial plastic surgery. And while their specialty obviously still tends to stay regional, the public doesn't know, and there are a great number of surgeons who are expanding beyond those specific areas. And just an important term to know, facial plastic surgery is really that year of training. I think some programs might be a little bit longer, but generally a year of training beyond otolaryngology training. Now, the one that you specifically asked about is such an important area for me to discuss. And I think that's the most misunderstood area in terms of what people should know in terms of picking the right surgeon for them. It doesn't come across easily that there's a big difference between a cosmetic surgeon or a plastic surgeon. It also becomes more confusing when people say that they're a board certified cosmetic surgeon. There's the American Board of Medical Specialties recognizes certain specialties and therefore will have a true board, as in terms of recognized by the American Board of Medical Specialties. You could be board certified in general surgery, you can be board certified in neurosurgery, orthopedic surgery, things like that.
Mhm.
Well, for example, myself, with my education and training, then I was qualified to sit for and pass the examinations and the ongoing recertifications and educational requirements to be a board certified plastic surgeon under the American Board of Plastic Surgery. Cosmetic surgeons can come out of, or the people who claim board certified cosmetic surgeons can come out of almost any specialty. I almost feel like it could be literally anything, from dermatology to pathology to gynecology, etc., and with very limited coursework and not necessarily the same amount of training, especially on the surgery side. And this organization has been set up to say, oh, we're gonna say that you're a board certified cosmetic surgeon, but it's not even recognized by the American Board of Medical Specialties.
Okay.
It's such a confusing term. We spend a great deal of time on it. I've even dedicated a page on my website to it, and I think it's a public service to make sure people are informed, really well educated as they make such critical decisions in terms of where things can be.
Yeah, you're working on your body, and it's very important.
Yeah.
You know, someone that does do the extra training. This is really anything, really, but for plastic especially. I mean, that's the whole point. I mean, so many people go to a plastic surgeon for the results, and I mean, several of you ladies and I have discussed this in the fitting room many times, that these plastic surgeons, I mean, they're so smart and they're amazing, but are truly artists as well. And each one that you go to kind of has a different result and different techniques and different ways that they do it, right?
Absolutely.
And lacking that training for the plastic portion, you really are missing that opportunity to get really the better results, honestly, but more experience and more knowledge. And, but you had mentioned your website really quick for that page. What is your website?
It's Wirth Plastic Surgery, so my last name is Wirth, WIRTH, plasticsurgery.com. And we also have our Instagram and Facebook and all those social media handles and everything else. And we have a fun little hashtag as well, which is hashtag worth it. And it's WIRTHIT. So I do love that.
Yeah, so if they want more information on that, they can go to the website and kind of read on that. Now, I want to throw out there really quick, if anyone has any questions during this time, either about breast augmentation, about, you know, the surgeons and the difference, and how do I find a good surgeon? What do I look for? What do I do? Where do I go? Definitely shoot in the questions as we're going here. You know, we're doing live chat, whatever you want to ask, let us know. But also I want to get back. It's so important. So now it kind of leads us back into breast augmentation. So many of you ladies out there, again, breast augmentation, the official name, but most will refer to it as boob job, right? I need to get a boob job. I want a boob job. But what exactly is breast augmentation? What do you do? What does that entail?
So breast augmentation, and officially listed as augmentation mammoplasty, everything on plasty is about shaping and forming, is really about enhancing for the most part, the volume. And once within that, getting the right shape, projections, symmetries, all those things come into play. So it's really sounds simple, and while the surgery itself doesn't need to take a great deal of time, it's really a matter of how much the surgeon's going to put into proper planning at the front end, and then application. And just like any of the great surgeons that you worked with, you know, in the past, and you've seen me confidently go in and say, "Oh, I'm all set. This is where we're going to be." And make a maneuver, and let's say put the implant in. And if I just don't feel like it's perfect, I've got to make that adjustment. And it's about taking that time, because it's not just about getting volume in, whether it's saline or silicone, for example, but it's about getting the final result that as it turns out. I always talk to people with the idea that when they come in for the consultation, one of the things that's important to realize at the front end, and that sometimes we have to make an adjustment for surgically, is that all breasts are different side to side. Always impresses me how many women don't know that, and you probably have an unbelievable amount of discussions with that when you're trying to get them fit for bras.
Absolutely, and we joke also, and I believe we've said this as well in the OR possibly, and through the years, and I've joked with so many ladies about it, how, you know, they're sisters, they're not twins, right? So it's so common that they sit a little different. One maybe has a different size than the other, maybe the nipple sits at a different height, all different things, but all things to consider, right, for the breast augmentation.
Preoperative planning and intraoperatively, because the tissue won't necessarily move or sit the same way side to side. The differences may be something that are fairly structural, genetic, in terms of the breast tissue itself, or it may be something that has changed over the years with the skin. So
wait, skin changes over the years?
Yeah.
Ladies, gravity, not always our friend, but.
You've seen business to some degree. But then again, I always will joke around that I decided that aging is bad for my health, so I gave it up. I do a lot of things to take care of the skin. And there's a lot of things that women can do in terms of taking care of their skin before and after the procedures as well. But if there's a skin difference, which is going to be something that we treat a little bit differently than if there's a breast parenchyma or the breast tissue differences. And sometimes it's pure anatomy in terms of women are tighter on the inframammary fold on one side, or like I said, significant difference in the development. So there are opportunities to work towards getting them to be twins, all right? Because in the end, people like twinsies as far as the breast volume, symmetry, projections. The more that they are alike, the easier so many things become in terms of not just fitting for bras, but outerwear, bathing suits, shirts. The clothes sit better as well. And so even putting in asymmetric implants is an opportunity to create symmetry on the outside. And it's one of those things that it's finding the right person who's going to take that time to do that evaluation at the front end, as well as be able to tweak or manipulate the intraoperative results to get you the best long-lasting result with the lowest risk all in one surgery. And that's the goal.
Yeah, that's fantastic.
Yeah.
And it does take time and planning and regimens, right? And the rules they have to do before and after and listen to their surgeons.
Always listen to your surgeon. That's a big difference in the long run. No matter what Google tells you, I've spent years educating myself as to what works best for me. An interesting point, you will hear different ideas from different surgeons and especially in terms of post-operative care. So a lot of surgeons will still discuss their post-operative care criteria or algorithms or protocols, and you will find differences. It doesn't mean that, you know, one is absolutely correct. Most of us follow generally the same principles, but we like to do things a little bit different. And in particular for me, I have a very different post-operative regimen than most breast augmentation surgeons. I remember many years ago, I already sort of discussed when I did my fellowship training, but it's been a long time doing this. The experience that women had getting a breast augmentation was accepted, but to me wasn't acceptable. I mean, they were so immobilized, uncomfortable, restricted in so many different ways. And there's been some growth that has in all areas, but in plastic surgery, it's been a really big deal in terms of making things better, in terms of the experience going through. I would say that I rarely claim to be an early adopter, but that sort of pathways and protocols made sense and set me down a pathway of exploring how do I do things better, including and especially in breast augmentation, because I do so many of them. I'm really proud to discuss the fact that I have what I call my 24-hour breast augmentation recovery program. And this was such a huge deal in terms of growing as a surgeon and as a physician in general, taking a very large leap in terms of changing the way I use some of the medication compared to what my training had always taught me, like stay away from things that would thin the blood, like ibuprofen, for example. But now I use it immediately, including right in the recovery room, that type of thing. But this 24-hour breast augmentation recovery program has been such a dramatic change and such a blessing for so many women. I will talk about the fact that it has been a practice builder because their friends are like, I need to know more about this.
Yeah.
And so I could discuss it a little bit more if you're interested.
Yes, we definitely will. I'm gonna circle back around.
Sure.
Because I know everyone is really interested and wants to hear about the implants as well.
Absolutely.
Kind of what goes in and what the differences are. And earlier you had mentioned saline versus silicone. This has been a long-term discussion with so many women over the years, you know. Silicone, what happens? Saline, what happens? What's the difference? Does it look different? Does it feel different? Does it last longer? You know, lots of questions between the different ones.
I'm sure there are plenty of questions because you and I both get them along the way. So,
Yes.
So we'll start out with some, if it's okay with you, I'll start out with some basic categories of implants overall, and then we can kind of discuss each one in more depth as you think it's going to be best for your viewers.
And again, ladies, if you have any questions as we're going on about the different implants or anything that you're hearing, let us know and send in your questions as well.
Yeah, happy to answer those as we go along. So to sort of break things down pretty generically, I will say that this is a saline implant. Obviously, it's unfilled at this time, but saline implant, and these are all gel-filled implants. Out of these are round implants and these are shaped implants. And this is a textured implant versus these being smooth implants. And all of those factors come into play in terms of, you know, how I hear what you are interested in achieving and how I can apply what I know, do, and have available to me to achieve those goals for you. So while I'm going to get into some implants that I really don't even use anymore, it was extremely rare that I used them in the past anyway. I will start with the basic breakdown of saline versus silicone.
Absolutely.
So let me move these sort of more to the front here. I'm going to tilt them up on these implants here. The implants themselves, there are a lot of people who come in and say, well, I only want a saline implant. I don't want any silicone in my body. Well, it actually starts out with a silicone shell. So there's still a little bit of silicone that's in the body. So both implants have a shell that's made with silicone. This has a gel that's already formed and fit inside of it. This is a silicone shell, and it has a little port site here that intraoperatively you've seen. We have a little fill tube, and intraoperatively I can go ahead and say, all right, I'm starting out with a basic size implant based on measurements and my initial consultation and all that planning that we talked about. So with that size, I'm basically going to fill right around that number. And while I can underfill a little bit, we tend to allow ourselves a little bit of room to overfill the saline implants by just a slight amount. And if you think about a balloon that's sort of been inflated and deflated, etc., when you reinflate it, there's always a chance of seeing just a little bit of rippling or contours. With a very slight overfill, we're generally able to eliminate that with the saline implants. And I make the argument that we can be a little bit more precise with the saline implants if we want to. That asymmetry, sisters not twins idea, for example, here I might be able to say, oh, on this side I want to put in another 17 cc's of salt water, saline, and on this side I want to take out 7 cc's and make these little adjustments to be like, I really love the way that looks. We could obviously be a little bit more or less dramatic than those numbers, but we can do that with the saline filled implants. We can't do that with the gel filled implants. These are set sizes. Now I will make a couple other distinctions on these that I think are important to think about. So I'm going to hold 2 gel filled implants in a very unnatural fashion here, okay? But if we look, I'll try and go this way and be able to twist it a little bit. The idea, and I'll have you sort of feel across here and show people where that rippling is. Okay, and so there's rippling that's there, and hopefully that'll be caught on camera pretty well. Obviously, these implants are not going to be sitting in the body in that manner, but that rippling can show up. And there's a pretty good divide among plastic surgeons even that feel that there's less rippling with saline and those that feel that there's less rippling with silicone. I personally fall on the side that I think there's less rippling with the silicone gel filled implants compared to the saline implants. And then one other large differentiator I'd point out at the front end is we talk about some complications associated with implants. One of them is rupture. So over time, these are not lifelong guarantees. These can break down. If they break down and rupture on the saline implant, your body's really just going to reabsorb that salt water. It's the same idea of putting drops in your eye, the salt water drops in your eye with contact lenses, that's saline. So your body just readily will reabsorb that and you'll go flat on that side. So it'll be rather obvious that there's a deflation or a rupture for the saline implant. For the silicone implant, and I show this in my book called Personalized Breast Care as well, so you can find that with my name on Amazon, for example. You can cut this implant, and I show that you can squeeze the heck out of it, and the gel would actually come out, and when I let go, it would go back to this shape. Because it's not the shell that's holding the gel in place. The gel is more cohesive gel, and that term that everybody's using these days, gummy bear. So they're all essentially gummy bear or more cohesive gels. And so these generally don't demonstrate that there's a rupture until it gets picked up most of the time on a mammogram or an ultrasound or an MRI exam that might have been done for some other reason, or for breast cancer imaging, surveillance studies that are out there. So that's kind of the biggest differences, in my opinion, in terms of saline versus silicone.
Now, also you were discussing with the different types of implants. It looks like the different ones you have here, some are a little higher, some are a little flatter, some are a little wider, some are kind of, so it looks like besides just picking, okay, it's saline, silicone, there's also different shapes.
There
and
are
different, so profiles, if you will, for you ladies, how much projection you're gonna get, really. And if you, and again, planning with your plastic surgeon, each body type and how wide your torso is, and really getting the implant to fill in appropriately to your body is definitely, that's why you go to a plastic surgeon, because this is what they do. They know what works, and they know what the results are going to be afterwards. Now for the fun part though, for the ladies, right? If you want more fullness, if you want more projection and different, there are different types of implants and different profiles you can get. So if you just want a little fullness, or if you want to be out there, right? So yeah, so why don't we talk about that?
I'll say that I basically work from the inside out, and here at Brown Garden, you work from the outside in. We have complementary or synergistic opportunities when you want to enhance that upper pole or the cleavage, when you want to sort of camouflage things. Sometimes you want the sporty look, sometimes you want that elegant look, sometimes you want that, club look where you really want things out there, and you can do a lot with that, but it takes your expertise sizing people at the right way here at Broad Garden to be able to do that. I have to do a lot of that work with the discussions preoperatively, and then I fine tune it intraoperatively. So to get into a lot of those differences, I'm going to take one step back and talk about this is a very good opportunity to discuss differences between round and shaped as well, and why I don't use these implants. And I'll get into those, but let me just briefly touch on, we talked about these are smooth shelled implants, and you can do it here, but you can feel the difference between that textured implant versus that smooth implant. It's a very fine texture overall, but there's a lot of concern that came out of these. There's a very, very rare complication, but these textured implants and whatnot have been associated with a cancer cell line, a lymphoma cell line that's out there. And so some voluntarily and some were mandated to recall textured implants. So while they're still out there in the world and whatnot, I don't use them, and I tried them many, many years ago. I didn't feel like they made a huge difference. Versus this is a shaped implant, and you can see the teardrop shape versus the round. It's kind of already built in, and this could offer a softer upper pole. For example, one of the problems here is that about 15, sometimes a little bit larger percentages of the time, these can get what's called a malrotation, and then you have a very funny shape overall, and we don't want that. So these are some differences in terms of these, but these shaped ones actually, in particular, were the original ones that were called gummy bear, and it was the fact that they learned how to make that gel more cohesive and hold that shape that allows, for example, cutting that implant open and it still goes back to its original shape. But now all implants are gummy bear, as it were, in terms of the way the gel is more cohesive. So
which,
size
goodness,
yeah,
exactly. Fantastic leap and bound
yes.
for the old gel
Yes.
silicone implants versus the new.
Right, we've all heard the stories in terms of if it leaked and then created new lumps or bumps in the breast that led to more studies and biopsies, or even got up into the lymph nodes in the armpit. And it was always that, risk of cancer, or that discussion in terms of what's the cancer risk associated with these bumps. And while a lot of times it turned out to be silicone granulomas that had leaked out, now we're in these 5th and 6th generation implants that we're not seeing those problems. And that's I just think it's so wonderful to be able to move that direction, eliminate some of these concerns.
Absolutely.
But
absolutely.
And it sort of went around about, but it was to explain that there are very, very, very different shaped implants, which are the anatomic or the shaped implants. But in my practice for many, many years, I really only work on the smooth round implants. I happen to put in way more gel-filled implants than saline implants, but all safe, all very good, all serve various purpose overall. So let's take these examples here, and I'll just confirm something with these implants. So if we look, and there's not a great way to do this, but you can tell in this hand, this implant is wider than this hand overall.
Mhm.
And if I hold this up, trying to make sure that we can generally see if I'm pretty even, that the projection here is much more projected off of this implant compared to that implant.
Mhm.
And that projection is where we talk about how much it kind of pops off the chest wall.
Mhm.
Well, just seeing those differences, it's usually kind of a little bit of a shock factor when I tell people like your audience, these are the same volume implants.
Yeah.
Right? And so,
Isn't that amazing, ladies? I mean, look at the difference here. This is, hopefully you can see this on the camera here. Two completely different size CC wise to say. So
same
these are-
CCs, but
I didn't bring my glasses.
we should have you mark there.
So it's not as simple as saying, I want to be 375 cc. Yeah,
Whatever, yeah.
much more goes into it than this. And again, the importance of seeing a plastic surgeon who truly knows the difference and knows. I mean, if you were to put this in the same person, this would be two completely different.
And I
Yeah.
can claim appropriately, I put the same size in on both sides,
Yeah.
so, you
So
know.
it plays a big factor. And going into sizing, so a lady comes in and she wants to have a breast augmentation and maybe kind of has an idea. How do you figure out sizing? Well, how do you figure out what's kind of appropriate and what would look
Right.
nice or what they're going
Everyone
for?
has a different system. For me, after I spent a great deal of time educating in terms of differences, in terms of the implants and whatnot, and even different incision sites in terms of getting the implants in there. We'll talk about sizing. Well, we've already talked, at that point, we've already talked about sort of goals and sizing. And you know way better than I do, but there is no standardization in terms of cup size.
Oh, yeah.
So while I'll have the same discussion in terms of what cup size are you currently, what cup size do you desire, I just use that as a general framework in terms of what I might be trying to achieve. Beyond that, I take time to work on prioritizing. Is it really a matter of projection? Do you just want as much volume and projection that you can get out there? What's your lifestyle? Long distance runners don't like really wide breasts.
Mhm.
So somebody who says, well, cleavage is my number one goal. We have to be able to tolerate a little bit more volume laterally because we might need a wider implant for that person. Whereas the runner or somebody who really wants more pop and is willing to tolerate more roundness on the upper pole of the breast, we might work on something that's a little bit more narrow, a little more projected, even within those things, even within those guidelines. So I take the time to try and get a really good gauge of what the end goal is, because that's the person who's living with the volume and the shape for many, many years. Then I'll give my suggestion, and I'll say, okay, here's my physical exam demonstrates that your measurements from all these different areas. We tend to measure like sternal notch to nipple distance on each side, internipple distance, the breast width overall, because everybody's breastbone or sternum is a different width, and that's where the muscle comes in and sort of restricts things. The look that they want might make a difference in terms of putting the implant above the muscle, completely below the muscle, or partially below the muscle. I put all those factors together in my practice. I basically will tell people, this is what I believe is going to match all those goals for you. I suggest approximately this volume and this style of implant, okay? Because as we go up, as we talked about the different projections that are there, and they all have different names. I won't get into all the different company names and everything, but as you get into different projections, all those widths and projections not only make a difference, and I'll cut ahead a little bit. Even if you were to grab these, you can clearly feel the difference of a more firm cohesive gel versus a softer gel. And even when we held them up, you can see that the softer gel might demonstrate a little bit more of that rippling, for example, compared to a more cohesive gel. But this could be a little bit more of a done look. So as we get into the idea of what are they looking for, I give them a guideline. I say, this is where I believe you should be looking, right around this range. And then we have a sizing system that we go through. So they'll try on different sizers as well. And that will help fine tune that preoperative planning.
You put the sizer in the bra under clothing, kind of look and get somewhat.
Extended bra, we tend to do it both with what we call day wear and evening wear clothing, because it's such a dramatic difference. Some people will think, well, this looks, for example, too huge when they're, wearing their, what we call our day wear clothes. And they'll be like, I like it, but it's too huge. Like I could never go out with my family or my in-laws or something. And, you can say, well, let's try this on with the evening wear. And they try it on and they're like, no, that looks really elegant. It didn't create the concern. My concern is gone now. And out of that sizing system, sometimes people will take that volume and want to, augment it a little bit further, or they'll say want to back off. But what I'll do is I'll set a number. We agree as a patient and as a doctor or a surgeon. Say, great, this is sort of our starting point, and then we go over again, what are the main priorities? Because if cleavage is more of a priority or upper pole is more of a priority, those will make a difference in terms of how I fine tune that final decision. So while I never promise a specific volume or cup size, we work together to sort of get right into that zone, and then I make minimal adjustments as needed to be able to hit those goals.
To achieve everything, right? You're talking about the symmetry, the look, the everything for the proportionate to the body, and now again, I know you had mentioned before your office is in Newport Beach.
It is.
And website was
WirthPlasticSurgery.com.
Now, where is your office?
It's been a lot easier in my career just to simply say it's at Fashion Island.
Fashion Island.
I tried to just talk about the address. People ask a lot of questions, and it always turned out, oh, you're next to Fashion Island. Yeah.
Yes.
And now we just started with, I'm next to Fashion Island. They say, are you in the tall white buildings? Yes, I am. And out of those, it's amazing how many women already know that I'm at 1401 or 1401 Avocado Avenue, and I'm up in Suite 810.
The top.
It is very nice, yeah. It's very relaxing every once in a while, just to kind of stop and look out the window, and you can see, the harbor, and we can see all the way to Catalina. And up to Palos Verdes Peninsula, and some days, if it's really clear, usually after a rainstorm, we can even see the outlines of some buildings in downtown LA. So it's actually much more than I ever imagined in terms of a space where I could be. So very blessed from that standpoint. But 1401 Avocado Avenue, Suite 810 in Newport Beach, and the phone number is 949-706-9988.
Perfect. And of course, if you guys ever if you have any questions or need to get a hold of Dr. Wirth and you didn't write this down or didn't, just call us here at Bell Garden. I'm happy to, get the information to you. And now, also, last thing I kind of want to touch on before we finish up here, just a quick thing for implants. Sometimes this is by choice, right? That you want to look different and you're choosing to. Sometimes cancer or some other reason,
right?
These are used for reconstruction, correct?
Absolutely, yes. So they're the same implants, but they get purposed differently. And so I have always been passionate about breast reconstruction. It is something that I've been very blessed has not been a huge issue in my family, but I was drawn to it very early, and making the refinements to improve outcomes, including, for example, a lot of the same techniques. The 24-hour breast augmentation recovery program that I touched on, which literally tells women to go out to dinner the night of surgery and start using their arms right away, for example, came out of a lot of the work to make the experience for breast reconstruction that much better.
Okay.
And the difference when you're doing the breast reconstruction is for most of the time, in a total mastectomy, all of the breast tissue has been removed. In a breast augmentation, we can camouflage the implants a little bit better because there's still some native breast tissue that's there. But breast reconstruction takes another set of skills and artistic application to be able to match up and get that really pretty teardrop shape where nobody needs to know that that woman has gone through breast cancer and mastectomy and reconstruction. And so there are different techniques that we utilize, including I have a silicone model of a design that I'm part of the patent on, where we use an allograft and we call this an internal bra. But it's basically a material that goes away. Your body will use it as a scaffold, but we use that to help hold the implant in the shape. Just like we briefly touched on that the implants can go above or below the muscle, but we can create a pocket to hold everything in the proper shape. There are other things, and I won't touch on tissue expanders now because we're really focused on the implants, but there are different ways to be able to achieve this. While breast reconstruction can also be done utilizing completely utilizing the woman's own tissue, or it can be done in combination of utilizing their own tissue, for example, their belly and their back with an implant. It's a matter of designing the right operation to get the symmetry, that volume, that projection, to get back to that point of, so that nobody else needs to know. We want women to get through something that's very difficult and be able to move on and enjoy the rest of their lives without a burden of having a difference that occupies any of their brain. You know, we want it to be spot on so that they can move forward with their lives and whatnot. And so it's a big opportunity to be able to do that. And it doesn't matter to me if it's a breast augmentation, a lift with an augmentation, a breast reconstruction. The honor and the responsibility that I feel in terms of women entrusting their care to me, I'd never take that for granted. So it's about, you know, giving everything I've got with every person every time. I will touch on one other thing. Whether it's breast reconstruction more often, but sometimes even with a straight breast augmentation, there is an opportunity for fat grafting.
Yes.
And fat grafting is one of the few other things that I will say I was an early adopter on, and I principally used it for breast reconstruction, but it's moved into the cosmetic world, not only in terms of face, but in terms of breast. It's not usually a difficult question to ask, but basically I'll ask a woman, are you willing to give up fat from somewhere else on your body? And I've never been turned down that offer.
You know, it's so funny that you say that, because in the fitting room, quite a few times we've joked, that's too bad that our bodies aren't like clay, where we can just kind of mold it where we want to put it. That's kind of what you're doing, essentially. You're taking it from areas that maybe you don't want it or don't, you know, and putting it to areas that you do. Whether it's just not necessarily, is it for volume or is it for? It's for volume, for shape. There's a lot of different applications, but it's pretty standard liposuction technique where we take the fat from. There's a lot of different papers that are out there in terms of how you process the fat, all within the same surgery, but you treat the fat and then how you put it in. We're all tend to be very careful in terms of putting in with little droplets and whatnot. So I always caution that you end up a little bit more bruised where I put the volume in than where I took it from, to the degree that there are people who are doing small augmentations with fat alone. To me, that's the exception in my practice, not the rule, but there are some people who are advertising that they can, you know, do very large augmentations with fat alone. It's usually a staged procedure, meaning multiple procedures rather than once and done with the implants, for example. But it's absolutely possible. And some women who might want to come in for breast augmentation, having heard about that option, say, well, all I have is just enough difference that can we fix it with fat grafting? And that's, you know, where I find that I can make a big difference sometimes for a woman who says, oh, I don't really want the implant if I don't need it, but this fat graft, if the fat grafting can get me where I want. And that's where you have to decide, are you a proper teammate, and do you agree on the plan and the goals and expected outcomes? If you do, it is a unique opportunity that has worked very well on both the reconstructive side and is being integrated rather well on the cosmetic side as well. No, it's great. It's you know, we were talking about reconstruction, and sometimes when things come together and maybe there are dimples or maybe there are, it's great ways to help smooth it out and give a more natural look. And again, you guys, the difference between, I know I keep going back to it, but a fully trained board certified plastic surgeon. It's a world of difference. You're trained, and it's
Yeah.
amazing.
We've just spent so many years, there's still such a large difference, and I appreciate the opportunity to get that education out there, which is so much of what you do with your program is to educate in so many different areas. So we're so appreciative of what you do as well. And remember, it's synergy, because for us to be able to send somebody to you, for example, and your team, knowing that, again, it's one more step in that journey that helps these women, whether it was cosmetic or reconstructive, it's still a large decision. And to be able to work with that and finish, not finish, but move significantly along that pathway, where women are just projecting on the outside how they already know they feel on the inside, or the women who now have that extra confidence because they can fit properly into whether it's the bras, the clothes, etc. And then on my side, even be able to walk by that mirror, without any clothes on and go, I look good, and then move on with the rest of their day or their evening. Those are the things that are so meaningful.
Absolutely.
And so we appreciate that teamwork.
Yeah, no, it's fantastic. And one more time, I'm gonna give you your website and all your stuff, so.
And again, I'm Dr. Garrett Wirth, and it's Wirth, and it's the same spelling of Wirth in WirthPlasticSurgery.com, 949-706-9988.
You had hashtag worth it. I want to thank everyone for taking some time out of your day this morning. Again, happy Monday to you all. Hope you have a wonderful day. Thank you for watching this episode of Breast Talk, Breast Augmentation with Dr. Garrett Wirth. It's been such a pleasure and honor to have you here. You're welcome back anytime.
Thank you.
And to all of you, have a fabulous week, and we will see you soon.